Ron G Morning Show, Monday through Friday from 7 a.m. to 10 a.m. only on WSAN Radio. All right, everybody, good afternoon. We're here on the Ron G afternoon edition of the show. And I have met this young man. He has been out at Coach K with her health wellness event that she does all the time. And he is here today with us. I'm saying you're not Mr. Musan?
Oh, Dr. Musa.
Musa, Dr. Musa. Okay. We appreciate you taking time out coming on this afternoon, and sorry for the technical difficulties, but we are here. Let me see, for our listeners right now, for the first time, tell us, what is the Kingdom Healthcare System?
We're a 501c3 nonprofit founded in 2018 with the mission to show God's love to all people through healthcare. So we've worked by having a pop-up clinic and temporary clinic setting where we can provide medication refills, counseling, physical examinations, and prayer for patients. So since 2018 to 2000, or I guess to the present, we've worked with different churches, different community groups, and different locations where we can actually see patients. But what's really has changed is now, starting in February of 2026, we have our own standalone location. So we'll start seeing patients during the week instead of just during the weekends. And depending on the funding and how much people support us, we'll be able to open 5 days a week to provide basic primary care services. So that would include medication refills, physical examinations, health counseling, and we are faith-based, so we do provide prayer for patients, but we do not exclude. So we see patients from all religions, all walks of life. Our mission is really to show the love of God to all people through healthcare.
Oh, so what community needs do you see in San Antonio that made you start this work?
Well, I'm glad you asked that question. So in 2018, my wife is a neurologist. She has a private practice, Kingdom Healing Institute. We we were doing very well. I'm an anesthesiologist, pain doctor by trade. She's a neurologist, epileptologist. We had a practice on the south side, and I worked full time as well. So we decided let's give back to the community. So we decided to open our clinic for free on Saturdays where we could take care of patients. And it started off as a gesture, just a thank you. Thank you, God, that you've done so much for us. Let's give a little back. And we started to get more volunteers. We got more patients coming, and it was really a self-funded endeavor. We didn't look for grants. We didn't look for donations. We just did it out of the blessings that God gave us. And then I remember I saw a patient. He came in for leg pain, and I'm a pain doctor. I thought, great, he's about to see a pain doctor, a triple board certified pain doctor for free. This is his best day. I could treat any sort of leg pain. So I walked into the room expecting to just wow him with how amazing a pain doctor I am. But I started to smell something. And as I moved closer, I took a look at his leg. It was wrapped in this bandage that was green and had pus coming out, and it smelled. And I'm just looking here as I unwrapped it, I uncovered this gangrenous leg. And I'm just sitting here in horror. And I asked him, Why did you wait so long?" And the problem is, he didn't. He's been going back and forth to the emergency room over a couple months. He has diabetes and he had an ulcer that got infected, but he didn't have primary care.
Mm.
Eventually, he got tired of the way he was being treated, and he just hoped it would get better, and he stopped going. And after a couple of months, he shows up to our clinic with a leg that's fallen off. And I just sit there in horror. This is 2018 in the United States of America, and I have somebody walk into our office with a gangrenous leg. So I did the best I could. I told him that when you go to the emergency room, they will see you. They will take care of you now. And we prayed for him and we just ensured that he can have follow-up care. But that moment really changed how I looked at healthcare because I'm Ivy League trained, I'm highly educated, but there was nothing I could do for that person because our system, our healthcare system, has really failed them. And from that moment on, it became less of a do something nice for the community, but a passion to really change healthcare.
Wow. See, I agree with you on that right there because if you need medicine, pharmaceutical companies out there pushing that medicine all they want, but something as simple as that right there going in, and somebody just dropped the ball or didn't want to treat him or something, and look where it went. I mean, I can see the expression on your face by opening up that wound and seeing what's going on, trying to figure out where did they fail him at.
Yeah.
And they a few times he was failed for it to get that far. So do you know what happened to him later on with his leg? Did he lose it or
So
anything?
I we didn't follow up because unfortunately, with these type of situations, patients don't always follow up. But the good news was he had a place where we could refill his medications if needed. But I think once he went to the emergency room, the severity of that, he would have gotten care. And I used to think that like that was well, that's just a one-time thing. But I recall, I think it was January of 2024, there was an article by the New York Times that talked about diabetes here in San Antonio. And it's one of the most prevalent cases of amputations for diabetes in the United States. And it could have been my patient that I saw, and it just talked about the gaps in care and how patients are not getting adequate follow-up or they're not getting adequate education, and the emergency room turns into primary care, which it is not designed to do.
Right. See, I myself, I have type 2 diabetes, but I am going to the doctor. I'm checking everything night and day. If I feel something out of place, I let the doctor know because I'm not, for instance, now, black men in general have very difficulties in going to the doctor. That has been around for years. I don't understand. I don't know why.
Well, the reality is that a lot of people, if you don't go to the doctor, you don't have a problem. But when you go to the doctor, you find out you have all these problems. So if I'm a smart man, well, I feel good, nothing's wrong. I don't need to hear bad news.
Mm,
It's that mentality that really can keep people keep people from preventative medicine. And that's one of the reasons we want to go into these communities and have a safe space that, hey, come ask a question. Even if you just want to talk to a doctor, we're here. Our medical knowledge is a lot more than ChatGPT or Google. So if you talk to a real person and somebody that looks like you and cares about you, you're more likely to listen. And we
yeah,
found that by our health fairs, we partner with Texas Kidney Foundation, and we've been able to screen so many patients for chronic kidney disease, and then patients who have freshly diagnosed high blood pressure or diabetes. Now it becomes a synergistic relationship where they can follow up at our clinic so they can start taking care of those issues that could lead to chronic kidney disease. And it's really going to take individuals and organizations saying, you know what, we will take charge of our health and we're going to focus on prevention. If we focus on prevention and healthy living, we'll use less medications, we'll have less complications or end organ damage from the toll of chronic disease, and we'll live a healthier, longer life. But we have to be intentional about it. So I want to make it easy to be intentional. Like, hey, I haven't seen a doctor in a year. I'll go to one of those Kingdom clinics. They're usually nice people. They'll take care of us.
yeah,
I can check, I can see what's going on. And that mindset, it changes healthcare from this scary, man, I'm not going until I'm dying to
yeah.
let me just go and make sure everything's okay.
Hmm. And you brought up kidneys. It's so funny. The next series of questions deal with kidneys. Hey, everybody, he did not see my questions, okay? Um, why is kidney health a priority, and what warning signs should people not ignore?
You asked a very good question, but unfortunately, the answers are not very comforting. Kidney disease is called the silent killer. And it's called the silent killer because there are no warning signs until you end up in the emergency room because you have a headache or there's something going on with your blood pressure. And when they do the scans and do the tests, you find out that you're in stage 3 or stage 4 renal disease. And that's how most people find out that they need dialysis is by going to the emergency room um, and discovering this. So one of my other roles, I serve on the Chronic Kidney Disease Task Force for the state of Texas, appointed by Governor Abbott. I work with the Texas Kidney Foundation, and we're addressing this issue, and we're trying to address it en masse. So in my role with the Texas Kidney Foundation, I serve as their medical director. So I'm a part of their screenings for rare and chronic kidney disease. One of the issues in communities of color is that we erroneously attribute kidney disease to just bad health care. Like you're not taking care of your blood pressure, you're not taking care of your diabetes, so you end up with end-stage renal disease. Well, that's not actually true in a lot of cases. What we are considering rare and chronic kidney disease is actually more prevalent in communities of color. So that's why we're doing genetic testing to see if you have the risk factors, the genetic risk factors that will predispose you to more rapid onset kidney disease. So if you have different, I blank on the name right now, but if you have different genetic haplotypes for these kidney diseases, you're going to find that your kidney disease will progress at a much more rapid rate than somebody else's. So it's important that if you have a family history of like I have brothers and aunts and cousins who are on dialysis, it may not just be you guys have bad diets. There may actually be a genetic component that you may not be able to address the genetic component, but it makes you more aware of what's going on so you could take better care of the controllable factors. And there are new pharmaceuticals that are targeted toward patients who have kidney disease due to genetic components.
A follow-up question on that is, what are the top risk factors that put someone in danger for kidney disease?
High blood pressure, um, diabetes, um, and then really any cardiovascular issues. So if you're obese, that puts more strain on your cardiovascular system, and that could put you at greater risk for kidney disease. But one and two are blood pressure and diabetes, and then you'll have toxins and environmental exposure. But something that's very overlooked is pharmaceuticals. Like for example, ibuprofen, Aleve, you're taking that over and over again. Well, over time, that can damage your kidneys. A lot of the medications that were prescribed casually can have side effects to your kidneys, and that's why it's important look at to look at your entire medication list and see if there's anything that are considered nephrotoxic or damaging to your kidneys. You have too many medications that can have side effects for your kidneys, then sometimes you can actually switch to something safer, but you won't know unless you look.
So let me ask you something. When I get my blood work done, and I talk to some people about that, when they run my blood work, they look at the protein,
Yes.
and 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 I asked the doctor, and really too much explained to me. All these told me, "Oh, you're good. You have nothing to worry about." I said, "So when do I need to worry? Is there a preventive way of this?" So can you explain to everybody what they mean by protein? I guess
Yes.
it's in your urine.
So if you have protein in your urine, that's a marker of how well your kidney is clearing toxins and how well it's filtering. So if you have too much protein in your urine, that means your kidneys aren't filtering appropriately. You shouldn't have high amounts of protein in your urine unless in disease states or some other secondary factor. So we really look at your BUN and creatinine. We look at those numbers and those ratios to determine your GFR, your glomerular filtration rate, to see how well your kidneys are filtering. Creatinine is usually the marker that we use to see your filtration rate. Now, interesting that you mentioned that your lab values are fine. Historically, the values used for African Americans, well, let me rephrase it. The formulas that were used to calculate your creatinine clearance and your GFR erroneously attributed muscle mass in African Americans as a reason that their numbers are will be slightly off. So a lot of times, if you're going just by the standard numbers, it could inappropriately predict that your kidneys are healthier than they are. So one of the things, this was before my time, but with the Texas Kidney Foundation, they actually helped to change some of those testing guidelines and some of those testing formulas so that the machines that are used to report those numbers are now are not correcting, are not using race as a factor, which can affect the number that you would get, and it can negatively affect the prediction on how well your kidneys are. But to simplify it, you look at your the protein in your urine. You don't want high protein. You look at your glomerular filtration rate. It's typically a number above like 65. But the most specific way you can take your numbers yourself and look at it, there's something called the KDIGO heat map. And it looks at creatinine, it looks at your kidney function in relation to age and height and all these factors. So you can see what's normal for your for your age bracket. And that's something I can provide later or provide a link. And that's something that the Texas Kidney Foundation has been um, advocating in all of their screening events.
Oh wow! See, you explained that much better than my doc. Well, anyway, that it's not my doctor anymore. I switched. I always tell everybody, if you're not satisfied with one opinion, go for a second or third opinion to find out what's going on. Now, you brought up something that I got to ask you a question about because when they come up with all these numbers for diabetes, AC1, and all this stuff that they come up with, I asked somebody one time, I said, now, race got a lot to do with it. How are they getting these numbers? Are they getting it from white people or from black people? Because sometimes those numbers don't jive like what you just said, because we eat totally different. The foods that we eat, blacks compared to whites. Now, does that have an effect on our health in the long run and on diabetes and all that? Because I'm trying to figure out where they get that single number. Say, okay, for instance, your blood sugar count. They was telling me mine should be between 90 and 110. I'm good. It's been at 104, so I'm great. So where did they come with that number
Yeah.
that you
So
got? you know?
yeah, so for diabetes, those those are pretty those numbers are pretty old in terms of looking at what levels are associated with actual tissue damage over a prolonged period of time. So when you're looking at your blood sugar, like that's a very acute marker. We know that if your blood sugar is over like 120 for a period for 100 for a period of time, that could start damaging the vasculature and lead to strokes and heart attacks, etc. Now, the hemoglobin A1C, that's looking at the glycosylated hemoglobin. Basically, it's looking at the sugar on your red blood cells. So that's over a period of time. Now, those numbers are usually determined after clinical trials, and one, clinical trials are often biased because there's not a lot of minorities in them. So the numbers, they may not always directly correlate with race, but we always have to remember that race is a social construct. Like at the one thing, all kidneys are pink. It doesn't matter like what color you are, like your organs, the way that we function are more similar than they are different. And we're the human race. So a lot of these numbers, yes, they're generalizable to vast populations. Now, what's normal, for example, when you look at different blood tests, like, yes, there are genetic factors that are different for blood tests. For example, African Americans, their African Americans can have sickle cell or sickle cell trait, et cetera, and that can affect some of your other blood numbers. You have people from Mediterranean populations and even African populations who have naturally lower white blood counts. So if you just go to the doctor and based on the laboratory standard, like for example, myself, I have my family is we're Nigerian. and there's some populations that have lower white blood cells. I went to the doctor. My doctor happened to be Nigerian, but my white blood cell count looked low, like real low. Like, do you have leukemia low? But he was
Yeah.
like, this probably just a natural variant. We're just going to watch it. And sure enough, we watched it for a year. We looked back a couple of years. It's always been that number. Now, if I were at a doctor who didn't have that knowledge, could I have undergone some invasive tests and a lot of monitoring? Yes. But that's why you have to really still be your own advocate. And like you said, a second opinion, that's great. But after a while, if you're on your fifth opinion, like don't ignore what's knocking on the door, okay?
Right.
Yeah.
You got a point right there. I stopped after my third, but I never went that far to my third opinion because deep down inside, people got to know their body, and they have to know what's going on with their body. If it's something don't feel right, well, it just don't feel right. But we sort of self-medicate ourselves. Oh, I just take some aspirins. I just go do this and go do that. So you're putting a band-aid on something that can come out very, very bad for you in the long run.
That's true.
Wow. So we'll get off that. I got something else to ask you. How can churches, nonprofits, and small business partner with you?
So you can go to our website, www.kingdom hcs.org. And you can look at our website, you can donate. One of the things that really we're really ramping up is our fundraising because now that we have a building where we can start seeing patients on a regular basis, it's really limited by funding and volunteers. So you can look on our website, there's a contact button, there's an email address. You can hit the donate button, or you can also send an email and information in terms of you would like to partner. And I'd be happy to meet or have one of our colleagues meet and discuss ways that you could contribute. But right now, the main ways that you can contribute are financially and also looking at us on social media. Social media, share our social media posts. We always share what we're doing. On January 30th, Friday, January 30th, we're going to have a fundraiser, a karaoke fundraiser, where we're
Oh,
going to have a couple people, myself included, gracing the stage with our vocal talents for a good cause. Now, some people, they may not find my singing voice fantastic. I respectfully disagree with them. I think it is fantastic, but you'll have to come and see to be the judge.
I think that's a good cause right there. 'Cause karaoke is fun.
It is, but
I just love just doing it. So, what are some of the needs that you are needing right now? You mentioned that fundraiser and all that, but what else do you need besides that?
immediate needs. Right now, we're opening our clinic. We will need furniture. We need some medical beds and some chairs to actually furnish the clinic. We will also need volunteers, preferably bilingual volunteers, some people who can speak Spanish. We're on the south side of San Antonio, and there is a large community of people who may not speak English, and that can actually affect your health care. So I'd like to have volunteers who have some not working knowledge of Spanish that can be extremely helpful.
Yeah, that's a good thing right there.
Yes. And also podcasts. If you have a podcast or a social media platform where I can be interviewed and share the mission, this is really a grassroots effort to change healthcare. Our healthcare system, if you haven't been looking, we're in a state of collapse. We have a couple more years left before we truly diverge into a cash pay healthcare system and a universal healthcare, which is likely going to be universally bad. So we have to get prepared and learn how to navigate our healthcare system and provide alternatives. So my focus is to provide health care because healthcare and health insurance are two different things. And we're unfortunately sold this lie that health insurance is health care, and that isn't true. So my main mission is to focus on providing health care. However we can do it, we focus on providing health care as at affordable or even free in some instances. And the more we focus on providing health care, we're going to find more ways to take care of people and provide prevention. And prevention, if I can get you access to a doctor to manage your chronic illness, you won't have to go to the emergency room. And then you don't have to go on dialysis. Then you don't have to go on Medicare. Then you don't have to lose your job. Then you don't have to do all these things. Let's just stop it at the beginning and make it the cultural norm to seek to manage your health first.
Mm. Well, I'm gonna reach out to you right now. Anytime you have a subject or anything you want to talk about or do a show, WSN Radio is right here for you.
Outstanding.
You just let me know when, and we'll make it happen because this is some interesting stuff that you talking about, stuff I didn't know, and I learn something every time I interview somebody. But this right here in the medical part, this is what people need to know. Wow. Okay, what is the single most important? I'm gonna ask this question again because you just answered it for me. What is the single most important message you want every listener to take away from this today?
That your health is important, that you are your best advocate. We want you to seek health care before your health is lost. It's a lot harder to recover health than to maintain it. So the Kingdom Healthcare System, our mission is to provide health care to show is to show the love of God to all people through healthcare. One of the reasons we exist is because God is good. God loves us. He wants you to be healthy. He wants you to be well, and we get to be his hands and feet. So our whole mission is to show the love of God through healthcare, and we want to show our love to you. So support the Kingdom Healthcare System, donate to us that as a community working together, we can change healthcare.
Okay. And last question. Where should listener go to, like your website, to confirm a date and where you located at?
Yes. So there's a couple websites. Kingdom-hcs.org is specifically for the nonprofit. But if you just go to kingdomdocs.com, that's easier to remember. That has all of our medical ministries. So my wife has a private practice, Kingdom Healing Institute, where she focuses on neurological disease, but more importantly, brain health. She focuses on holistic neurology. So if you have memory problems, dementia, we have ways to treat you without medications. And the results that she's getting are just truly phenomenal. We have autistic children who are starting to speak. We have patients with Parkinson's who are recovering. We have people with dementia who are left for hospice, cooking and making jokes with their family. And this is without medication. So if you do have that specialized need, Kingdom Healing Institute um, has uh, has has cutting edge technology to help you maintain and recover your brain health. Also on Kingdom Docs, they'll have our nonprofit, the Kingdom Healthcare System, where we're providing the basic primary care, and that's our main outreach. Is how we show the love of God to people and to help people. And we'll also have our marriage ministry, Reign Together. My wife and I were both physicians. Let's just say we've been through some things, but
Okay.
because of God's goodness, we're here, we're serving, and we're thriving. And we want to show other people, other couples, how to reign together.
Man, yeah, I talked to your wife at one of the health fairs, and boy, I could talk to her for hours because she was giving me some good information. I tell you, and that's why I love the events right here because every time I see you there, I see your business there. I always got the questions. I'm a question type of guy because some of it relates to me, my personal health, that I just want to know what's going on. Like I brought up with you about the count with the kidney and stuff, the protein count. It was never explained to me like that before. And so I think that's the bottom line. What I'm trying to say is if physicians explain to their patients layman terms and quit using all that talk, yeah, I get a lawyer or encyclopedia to read up on it. Just tell it to me straight. Don't go through all that. I
Be
know you
gentle.
had,
Be gentle on the doctor. So
yeah,
you
I
you also
know.
have to look at the healthcare system. Like we have 30 minutes, we're chatting. I mean,
Yes.
I'm not seeing five patients at a time. The reality of our healthcare is you have on average 7 minutes for a patient visit. The average primary care doctor, 7 minutes per visit, seeing about 20 patients per day. And that's not including all the phone calls they have to deal with insurance if their back office isn't doing it. They have to do peer-to-peer. They have to send prescriptions. They have to document and write. They have to edit everything that the insurance rejects. So it's a system that's designed to fail. It's a system that's not designed for healthcare.
Oh,
The
wow.
doctor that you see is juggling 1,000 different things. And yes, they want to provide healthcare, and they give you exactly what they have time to give you. They give you the information. Yeah, these are your numbers. Here's what you need to do. Next, because that's all the time you have.
I don't mean to laugh, but that's kind of sort of funny because people don't know what's going on behind the scenes, what they're doing to help you out. They don't understand that. Well, when I switched doctors, I did that, and after my first visit, she actually called me back and told me how was everything going. I never got that from a doctor before.
Yeah, that's
And
very hard to get in an insurance-based practice, and that's why a cash-based model where you have a membership subscribing. For example, our private practice is self-pay, and we have a membership model. It reduces the amount of patients we see, but the quality of care is incomparable. For example, my wife, when we opened in 2023, she had a patient who showed up to the emergency room and was because they had a headache and it was diagnosed as a brain tumor. Not a fast-growing tumor, but it's a brain tumor. So what did they do? Like, well, there's nothing to do right away. You need to go see a neurologist and a neurosurgeon to get worked up. So they sent her home. She's looking online, calling with her insurances. Her next appointment for a neurology is 4 or 5 months from now.
yes,
And she's just like, this patient is just like, what am I supposed to do? So they found us online the day after they went to emergency room. My wife was able to get that patient in the same day. So one day after diagnosis, she sees a specialist, a neurologist. The neurologist, I mean, she knows what she's doing. She ordered all the exams, all the tests, got her worked up, called the neurosurgeon on the phone, got this patient a consult with the neurosurgeon within a week, and within 2 weeks of diagnosis, this patient had the brain tumor removed. Why? Because she worked outside the insurance system and she focused on health care. The issue is people don't want to pay for health care. They want to pay for health insurance. But health insurance isn't caring for you. Like you're paying on average $473 a month for your premium. It'll take on average 26 days to see a primary care doctor, 4 to 6 months to see a specialist. So you're paying that premium every single month. And when you get to see the primary care doctor, you get 7 minutes. When you see the specialist, maybe you get 15, maybe you don't. And then you have to wait another 4 to 6 months for follow-up. So you are paying for health insurance, but you are not paying for health care. They're two different things.
I never looked at it like that. Man. Yeah, I got to have you back on, sir. We got to get you back on and stuff. So, any closing words for anybody before we let you go?
Well, I just want to bless all the listeners that God sees you, He loves you, and that healthcare it's important, and that God is positioning people. So if you lost your job, lost your health insurance, stay positive. That God's working it all out for good.
Okay, we appreciate you coming on. Will you be at the event on the 31st
Yes, I will be
of
there.
January? Okay, well, we'll see you there.
All righty.
All right, thank you, sir.
You take care and God
All right,
bless.
okay, bye.
Bye.
Thank you for tuning in to WSAN Radio. Catch us on our YouTube channel, WSAN Radio SA. Subscribe to our channel and hit that notification button.